Hi, I'm Matthew Enright, licensed acupuncturist and co-founder of The Sixth Element. I have a few questions for you. How many new patients don't begin care with you? Or begin care but drop out early? Or stay with care but don't refer? Are you getting consistent reactivations from past patients? And if not, do you know why? There's a good chance this stems from one of the biggest myths in our profession that we were all taught in school. And here it is. We're all taught that patients follow recommendations after we've educated them on TCM philosophy. But if this were the case, everyone that you educate would return, refer, and comply. And after a few years, your practice would be full from referrals, reactivations, and retention. But how many practices do you know of that don't require an endless need of new patients just to maintain or grow? Listen, I've given a lot of talks on acupuncture, and I've done a lot of examinations, all with the intent on educating the patient on what we understand. But it's taught me one thing. Educating our patients doesn't create consistent reactivations or referrals. I mean, let's talk about dentistry. We all know that it's healthy for us to get our teeth cleaned twice a year, but how many people actually do it? Logically and financially, it makes sense to go in for preventative care as opposed to waiting for a problem to develop, but how many people do it? Nobody wants to hear that they need dental work, yet dentistry is 100% accepted in our culture, unlike acupuncture. So what's the lesson? The lesson is that the majority of people make their decisions emotionally and not logically. And educating your patient never leads to their emotions. Think about it. How many times have you ever been in a lecture, a classroom, or even just a conversation with someone that's trying to help you or educate you, but you're just not interested? They keep talking and talking and talking, but all you're thinking about is how do I get them to stop talking? How do I get out of here as quickly as possible? And how do I make sure I never put myself in this situation again? And why is that? People don't want to stay in an emotionally uncomfortable or stressful situation, and they're certainly not going to refer others to it. I mean, why do you have patients right now that aren't referring other people to you that they know that you can help? Or do you have patients that you ask them to come in for a follow-up appointment and they say, yeah, let me check my schedule and I'll call you, but you never hear back from them? Because you're not emotionally connecting with your patients and you're not emotionally leading them towards what they want. So how do you emotionally connect with your patients? In The Sixth Element, I'll show you the 6 questions that absolutely must be asked on every exam that you do to get your patients to start following recommendations and referring others immediately. So thank you for watching, and I'll see you in the next video.